All right. Hello,
Hi.
everyone. I am Dr. Allison Mathews, founder of HIV Cure Research Day, and I'm here with Paul Edmonds. Paul Edmonds is officially the fifth person to be cured of HIV in the world, and we are honored to be here today with him. Paul, how are you doing?
I'm doing well. Thank you, Allison, for having me.
Yeah, absolutely. So I wanted to, I guess, start by asking some of the questions that I think most people would want to know.
Okay.
How were you cured of HIV? What was that process like?
Hey, just to give you a little brief history, in 1988, I tested positive for HIV and also got an AIDS diagnosis because of my low T cell count.
Mhm.
So then 30 years went by, and in 2018, I had leukemia, acute myeloid leukemia, and I needed a bone marrow transplant. So they looked for a donor who has a specific mutation, the CCR5 delta 32, I think it's 32. Anyways, that prevents HIV from attaching to your cells. So my donor had that mutation, and so when I got his bone marrow, uh, I no longer have HIV. Uh, so it's pretty cool after 30 years.
Yeah, I mean that is amazing, and
I mean,
I
I'm sorry. The goal was, of course, to get the leukemia in remission because that
right.
would kill me. It wouldn't have taken that long. Uh, so this, and there was a side effect, the HIV part, really
Hmm.
good side effect. So
I know. Were you participating in a clinical trial, or is this something that came
it was
about because doctors knew about it?
right. No, the doctors knew about this because of Timothy Ray Brown,
Right.
the first person. So they looked for that donor with that mutation, which is not necessarily easy to find because I think it's 1% of people in the world have it. Uh, so they actually found two donors. It took 3 months to get my leukemia in remission. And at the end of the 3 months, when it was in remission, the first donor was no longer available. And they had a second donor, which amazed me. I didn't know this until long afterwards. Uh, and so then in February 2019, I got the bone marrow transplant. In March 2021, I stopped my HIV meds, and I've been off them ever since. They can find no HIV anywhere in my body. So,
And then what was that like experience with stopping the HIV meds?
well, yeah, it was a little scary. I've been taking them for so long, but I was ready. We would have done it earlier, but the pandemic hit. So I waited an extra year to stop because I wanted to get a COVID vaccine before I stopped anything because I didn't know, what would happen. So,
Right.
so that's why we waited till 2021. Otherwise, it would have been in 2000 or 2020. I mean, that we stopped.
So
And,
one thing I get a lot of questions about why if you and Timothy Ray Brown and others have been able to be cured, why aren't we doing that for everyone?
well, well,
Um,
well,
Go ahead.
it's very expensive for one thing. It's also extremely risky. It right now the people who get a bone marrow transplant are people who uh, that's about their only option, to survive the cancer. So, and anything can go wrong with a bone marrow transplant. I mean, apparently had a very good match because I have not had a lot of problems, but Timothy Ray Brown did in the beginning, and the others before me also had a lot of issues that I haven't had. So I'm fortunate. It's getting better, I think, but it like I said, it's very very risky. it hopefully it's something they're working on to try and duplicate a way to do it without all that risk involved. Yeah,
Yeah.
I think they're going to get there at some point.
I've seen some people have now been declared cured without the what the bone marrow transplant, but without the CCR5 mutation.
The Geneva
So
patient, the last person, yeah, they did. They got a bone marrow transplant, and the donor did not have that mutation. Uh, excuse me. Uh, what's different about the Geneva patient that I've been told is they were on some medication to prevent the graft versus host disease, which is what it's called when part of your little bit of your original immune system is left in you, and it fights the new donor system that's coming in. It's called graft versus host disease. Uh, but I lost my train of thought. What was?
you were saying that they have that they had that complication, or you said they did not have that complication when they got the mutation without the CCR5
Yeah,
receptor.
the Geneva patient's the only one I'm aware of that, they can't find HIV, and he hasn't had a bone marrow transplant with that mutation. I mean, there are
Hmm.
other people I think they're calling functionally cured.
Right.
Uh, I'm learning as I go. It's all new to me too.
Okay. So how do you feel about the word cured versus remission?
Well, I'm fine with remission. I'm ready to use cured. But I'll wait. I think they're waiting for 5 years to go by, and then I think they will maybe say cured, like they do Timothy Ray Brown. They've decided 5 years is a good marker, I guess. So,
Okay.
but which the bone marrow transplant will be 5 years this February. It'll be 2 more years off of meds before having 5 years. So
What is your new birth date?
February 6th.
February 6th. Oh, so one day away from Timothy Ray Brown's birthday.
Oh, really? Okay.
His is February 7th.
All right, I didn't know
Yeah.
that. Okay. Yeah, we were just I live in Palm Springs area, and they we have a walk of fame like Hollywood does with stars on the sidewalk, and we just dedicated one to Timothy Ray Brown on World AIDS Day, and I spoke at that ceremony. That was really cool. So
Where and did you know him?
I did not. I wanted to meet
Okay.
him. But then the pandemic hit. Otherwise, I would have met him. He got sick during the pandemic. I wasn't ready to go to him before I knew because, I didn't want to jinx things. And
Right.
I just didn't know if things had worked or not. So,
Yeah.
yeah.
So, I think one of the amazing things that I've um now encountered in my personal life is that my mom actually just had a stem cell transplant on December 7th.
Oh,
So
wow.
that's her new birthday.
All right.
And I try to communicate to people that finding a cure for HIV or people's lives, a lot of people think that HIV is not relevant to them. But I think my mom and other people who have experienced stem cell transplants are a perfect example of how we are all connected. And, if something is impacting one group of people, then it's also impacting another, and it could also benefit another group.
Yes.
So, just trying to make that connection for people that, it's really important for us to care about and be involved in HIV cure research, and to learn more about it because it has also implications for all of us.
Absolutely. Yeah. Yeah. I think, it was work on HIV that led to a fast vaccination for COVID. I
Mhm.
think
Yes, absolutely.
played a role in that. So, yeah.
A lot of people don't even realize that most of the COVID vaccine researchers were HIV researchers. So, I kind of just stepped right in, and I'm not a natural science, I'm social science, but you know, same skill set, right? Like to be able
Yeah,
to communicate to the community and reach out and engage and
yeah.
educate, you know.
Your job is just as important as theirs, you
Yeah.
know,
Thank
because
you.
you have to communicate with the community, or none of it's going to work. They're not going to have people to do the studies. And anyways, yeah,
Yes, absolutely.
it is real important. I'm real impressed with the Martin Delaney collaboratories. I didn't know about them, uh, and
Well, that's the goal, is to help raise awareness about the Martin Delaney Collaboratory. So for people who don't know, the MDC, or the Martin Delaney Collaboratory, is a group of uh, study sites across the country and also across the
well,
world. They
yeah,
have some collaborations across the world, and they are working on different strategies to cure HIV. Some include the stem cell transplants, some include um, gene editing, and then others include uh, trying to eradicate the virus from the body through certain medications that they're also borrowing from cancer research and vice versa.
yeah, very,
So,
very, very impressive. I just feel certain they're gonna get there.
yeah, absolutely. Well, is there anything that you would like to say to people in the community, and then also just people living with HIV in particular,
Right.
that would motivate them?
Well, I, HIV doesn't HIV doesn't have to define who you are. You are your own person. You got your life, and HIV may be part of it. I hope that I represent hope for people. That's what my goal is to inspire the people living with HIV, to inspire the researchers and the community. That there's hope, and that we're going to find a cure.
And how apropos that you are the City of Hope patient.
I know. It's such a wonderful place. I can't say enough good things about City of Hope.
Yeah.
Incredible.
Thank you so much for taking the time
You're
to speak
welcome.
with me, and I hope you have a good day.
Okay, you too, Allison.
Is that how we got these pizzas?
Come on in.
We didn't know you were here.
Yeah, man, I popped in and had to make some pizza for you.
Oh my goodness. Hi.
What's up, man?
Where are you guys